And we've got a health alert now. Former reality TV star Nicole Snooki Polizzi revealing that she has cervical cancer. Polizzi sharing on TikTok that doctors made the diagnosis after she underwent a biopsy. She says she's considering getting a hysterectomy and has more tests ahead to find out if the cancer has spread to anywhere else in her body. Joining me right now is Dr. Jessica Shepard, Chief Medical Officer for HERS and a board-certified gynecologist. Dr. Shepard, thank you so much for being here. I mean, this is a story where it's really so important for her to speak out about this because she's 38 years old. She has a big platform. How prevalent is cervical cancer, and is it on the rise for younger patients?
Morning, Gio. Good to see you. I think that people hear this from a 38-year-old and can become a little bit alarmed. But cervical cancer, there are alarming rates when we think of this is something that can be prevented. And I'm so glad that she's speaking about it in a way where she's saying, please get your pap smears and HPV testing, because that is the way to prevent cervical cancer. It's diagnosed most frequently between the ages of 35 and 64, which is why we start pap test screening all the way at age 21. Now, she did note some notable things that are important for people to understand when we think of cervical cancer and cervical cancer prevention, is that she said she was doing her pap test and had some abnormal tests and continued to follow up, which is why they were able to find her cervical cancer at an early stage. And now she can talk about ways to actually potentially cure or get a diagnostic feature in doing the possible hysterectomy. But all in all, what I want people to understand is that cervical cancer is something that can be prevented, which is why we want you to go to your doctor and get your pap plus HPV testing.
Absolutely. And Polizzi says that her cancer is at stage 1. How treatable is it?
Yeah, this is imperative that she's able to say that it's at stage 1, because that means that it's an early stage of cancer, which means that she has the likelihood of getting a procedure that can actually take away the cervical cancer based on how they treat her with the cervical biopsy that she had, or with a hysterectomy, which is removal of the entire uterus and the cervix itself.
And Dr. Shepard, what's the connection between cervical cancer and HPV?
Yeah, HPV is the leading cause of cervical cancer. Now, HPV is human papillomavirus, and this is a virus that can be sexually transmitted. What the important part about HPV is that once it's detected on a PAP plus HPV testing, which is collected at the same time, that's when doctors can follow it and make sure that it's not leading towards cells that are going to turn into cancerous cells, leading to cervical cancer. So it's all connected in knowing the best information, being HPV tested with your pap, and then allowing a doctor to guide you through the process if you have any abnormal findings on HPV. And also with the HPV vaccine, this is a way that you can decrease your risk of having an HPV strain that can lead to cervical cancer.
All right, Dr. Jessica Shepard, as always, thank you so much for all of your expertise. We appreciate you.